Hi everyone, Dr. Timothy Gallagher.
And Dr. Michael Marciello.
And we're from Maragal Medical. This week we're going to be talking to you about our whole food medical weight loss program. Dr. Marciello has just returned from a medical conference, the ICNM conference, and he's got a lot of great information on trends in the field of holistic medical weight loss. This is going to be some great information. You're definitely going to want to stay tuned. Okay, Dr. Mike, so you just got back from a really cool medical conference in Washington, D.C., the ICNM. What does that stand for?
So it stands for International Conference of Nutrition in Medicine.
Wow, that's great. That's great. And, you know, talking to you since you gotten back and, you know, talking about our existing medical weight loss program that, you know, we really emphasize is a whole food medical weight loss program. With all of the concerns with all of the semaglutide injectables out there and the latest research, boy, this puts us in a great position to educate the area public about current trends and what we have to offer at our clinic.
Absolutely. The conference base really looks at not just whole food, but particularly whole food, low-fat, plant-based. And if you think about, that's exactly what we do. In a way, we kind of promote the aspects of the healthier foods, but even taking it to the level of, if you look at a person may be vegan, a person who is a meat eater, and everything in between, we really are looking at the ways that the food that we take in really makes a difference in our health, longevity, as well as cancer risks, as well as generally obesity or overweight issues. So those things are looked at independently, but also as a collective whole.
Wow, that's great. And that comes right into play with our program called NutriHealth. NutriHealth, we started a year and a half ago. We're seeing incredible results with our patients, and the whole goal to bring in a whole food medical weight loss program to our practices. We wanted to help our patients that suffer from obviously chronic inflammation, but also those patients that are overweight that are looking for a plan that is going to be sustainable. And we're in a unique position because our plan is a regimented protocol that is based on whole food nutrition. Everything that's in the plan you can buy at your local grocery store. We have the clinical support, and once you are successful and go through maintenance phase, and it usually takes about 5 months until we get you to a healthy body fat percentage, that's really where the journey begins. And this is the big difference with our medical weight loss program, NutriHealth, in our practice. Once you join this program, you will have medical support for the rest of your life. And that's really the key. It's the sustainability.
Yeah, the key takeaway is there's so many things that we can try to hold on to, but one concept was about 80% of people who actually improve in their weight is lifestyle changes. It's not just food. And so that's the idea that we're going to follow you, because as you follow our plan and you follow the food plan, the concept is you'll lose weight. That's a goal for many, but you'll keep those chronic illnesses under control. There was great lectures in relation to minimizing Alzheimer's disease, neurodegenerative issues like Parkinson's disease, elements of arthritis, which is what we take care of. Even there's early studies to try to look at how to minimize or prevent disc degeneration, because these are chronic inflammatory processes that take place by eating foods that are relatively unhealthy for us. So we're going to transition our food program right into a lifestyle program that we can continue to look at all those factors of your family genetics, what your behaviors are you sleeping, are you eating, and now you're actually just doing good things for yourself, like exercising.
Yeah, and folks, don't let Big Pharma fool you. Ozempic and those Wegovy injections, Mike, you definitely got some great statistics for that. I mean, the average person, listen, if you don't change your lifestyle, you're not going to have a sustainable plan. And in fact, more data is coming out about these injectables. You know, we know, as we've talked in the past, that once you are on these injectables, you're on these for the rest of your life, but there is a peak of benefit for these injectables, correct?
Yeah, there was an interesting study that, like all big pharma and pharmaceutical companies, they can manipulate the words of their studies, and we learned some of those things to watch for. and understand that some of this stuff is not as pretty as it sounds on television or in commercials. But what really struck me is that, again, the push is to use these medicines for the long term. Well, they suddenly changed their design study, in a sense, at least they're reporting, because of the longitudinal study, which means they're going to look at people taking these medicines for years. But they all of a sudden said, in 68 weeks, this is where this wonderful drug can really help take care of things. And when you look back at the data, and when the results were put up on a simple graph, it showed that yes, people lose weight, but the 68-week mark, which is a really odd number if you think about, most people design a study by 52 weeks, a year, or a longer 2 years. Well, 68 weeks was the time in which the curve flattened. So you don't lose any more weight, and you have to sustain this medication for the long term just to stay there. So essentially you have about a year and a half, year and 4 months, and that's what your goal is. If you don't change your lifestyle changes or actually make differences, that medicine can't do anything else for you except just continue to have to use it and hopefully not get side effects.
Yeah, and the funny part is, you know, most of our patients, they lose more weight in the 5 months than in the 68-week time span where those medications level out. And folks, if you're interested in learning more about our sustainable whole food medical weight loss program called NutriHealth, we're going to actually have an in-person seminar with Dr. Mike and I and our medical weight loss coach, Kelly Burlington. That's going to be Thursday, September 19th from 5 to 6 right here in our practice. And if you're interested in getting more information about signing up for that completely complimentary medical weight loss seminar, just click on the link below. We'll be happy to see you in the office so that you can learn more about this long-term sustainable medical weight loss program. Well, that's it for today. I hope you learned something, and I hope you're all excited about starting into the fall season and preparing yourself for the holidays and starting and ending this year off on the right foot, being healthier than ever for 2025. Have a great day, everyone.
Take care.